Okay, today we're going to talk about cysts, lumps, and fibroids. So, this was something that I wanted to talk about because it's been such a common thing that comes up in our office. Let me see, how can I go to full screen? Well, hopefully this is big enough for you guys. Okay, so I wanted to talk about this because we do thermography imaging and ultrasound, and we come across cysts and lumps and fibroids, and we talk with women about fibroadenomas and all types of different tissue growth in the body. And so normally this creates a lot of stress and anxiety, and especially with when you go get a mammogram done and something comes up on the mammogram or the ultrasound, and it can be very stressful to find out that there's a lump, unless you're in this industry and you kind of learn how common these things are and that they're not necessarily anything to stress over. Obviously, we want to make sure that there's not any sign of cancer, that type of lump, obviously. But what we're talking about today is more so the benign, lumpy, bumpy type of tissue that so many women come in and they're like, Rebecca, I want to do breast self-exams like I'm always told, but everything is just so lumpy and bumpy in there. I can't tell the difference between what's normal and not normal. And especially if we follow up with ultrasound, or you've had lumps come up on mammograms, or even ovarian cysts, like very, very painful cystic pain with ovulation or with your cycles, if you've had history of like uterine fibroids. There's so many different types of growths in the body. Even on the thyroid, we can see like cysts or nodules. And one of the things that I love to educate people on is like, what is driving this? I think it's really important for us to really learn more and understand the body's signaling cues to understand what our body needs. And so this talk is going to dive into all of that. So first, I just want to clarify what these different terms mean. So there's a cyst, which is typically a benign lump. Very, very rare for it to be like cancer if there's like a partially solid piece inside of the cyst. And this is something that we can see on ultrasound at our office. But if it's completely filled with fluid, I always tell women it's like a little water bubble inside the breast tissue or on the ovary. It just depends on where it's popping up. And this can come up on the kidneys, the thyroid, the ovaries, the breast area, all kinds of areas. Some people have had little ganglion cysts on their wrist that can get really uncomfortable. So there's a lot of things, areas that they can show up in. But today I'm focusing primarily on the breast cysts and the ovarian cysts, which would be on the ovaries, because it relates so much to women's health and they're so common. They do fluctuate in size, oftentimes with our hormone fluctuations, and they can pop up and they can completely go away. So it's been really interesting to work with women on their health, and they do follow up ultrasounds with us and they're like, oh wow, my cysts are smaller or my cysts are completely gone. So that's always encouraging for them to know that their body's more balanced. So the solid breast lumps that we might see on like a breast ultrasound, for example, would be like a fibroadenoma, which is like fibrous solid lump tissue, but its characteristics on the ultrasound, they're like, there's different characteristics that the radiologists look for, and some things look more serious like breast cancer, and some things are clearly like a benign lump that we would just monitor and make sure it's stable and not acting abnormal in any way. And so those can pop up from some of these root causes as well. And then the fibroids is in the uterus. That would be along the uterine lining, and those can be built up of smooth muscle cells and fibrous connective tissue. So some of these lumps are kind of like, they have similar characteristics or similar root causes, but they might pop up in different areas of the body, and they might be more fluid filled or they might be more solid depending on the type of tissue that it is developing. Now, fibroids in the uterus can be really, really difficult for some women to deal with, especially if they have low iron, if they're having really heavy cycles. So that's something that we absolutely want to work on, because when you're chronically anemic, it can cause a whole downstream of health challenges. And so that, of course, we want to be more proactive and preventive and not let these things develop in the first place, but we certainly want to do everything that we can to address if there is something like that present. And sometimes it's to the point where it's grown to a certain size. And same thing with cysts. If there's like an ovarian cyst or uterine cyst or something, some of them can get quite large. And unfortunately, in some situations, we might need to have some medical intervention, surgical procedure to just kind of reset that area and, overcome that bigger challenge. But I still want to just kind of talk about the main things that are within our control, the main things in our diet lifestyle that we can influence and support balance, so that we can be a little bit more preventive of these things developing. So here's why I think things can get, I guess, a little confusing. In our Western medicine mindset, we're very much, we look at the health as the body as separate pieces, separate parts. And what I found is that a lot of systemic imbalances that are in the body can affect different parts of the body. So for instance, like even if a cyst comes up in the breast area, that might most likely is a systemic imbalance causing that growth to happen in the breast area. And it's a lot more likely to also pop up somewhere else. So once someone has a cyst or a fibroadenoma or something like that pop up somewhere, it's not uncommon or like shocking, I guess, when we start to see some different growths in other areas of the body. So there's different concentrations of hormones in different parts of the body, and for instance, like estrogen receptor sites. And so certain parts of your body are going to be more affected by hormone imbalances, for example, than other parts. So I listed out the different areas, and this is why we might see a fibroadenoma in the breast and then a cyst in the ovary, and then maybe like a polyp or fibroid in the uterus. Like we might see some of these different growths in different areas. So vaginal tissue, of course, is really sensitive to estrogen levels, especially as they drop. Then we start to have more dryness and atrophy and damage to the tissue. The skin starts to get a little bit more crepey and thin because it affects our collagen production. Our brain, for sure, we can become irritable. We can have brain fog. We can have all kinds of effects on cognitive function too, memory, focus. And then thyroid, in an indirect way, the thyroid is affected by hormone levels as well, because if we have really high levels of estrogen, that can affect our thyroid conversion of hormones and things like that. So this is why I kind of like to look at the bigger picture. So this is a more specific example of, this is why when someone comes to me and they're like, oh, I have a uterine fibroid, or, I have a breast fibroadenoma, or I have this lump or that lump. My mind is always going to the upstream issues, the root causes that would contribute. And each person, you could have 5 ladies with a uterine fibroid. They might have different levels of issues with each of these categories. So it's not like we can just make assumptions and have like a cookie cutter protocol, but it helps narrow down like the areas of focus that we would want to dig into, whether they have a fibroid or a fibroadenoma. So this is just an example of how, 2 separate lumps in 2 totally different parts of the body can still have the same type of underlying issues. So this is a summary of all the different root factors that I have come to find and dig into with clients on their health. So whenever someone has a thermography scan or an ultrasound and they're like, yeah, I tend to have cysts, or I tend to have fibroadenomas or lumpy, bumpy breasts, my mind is instantly going to, what does their gut health look like? What is their detoxification capacity? What is their hormone level balance with each other? Iodine, different things like that. So when I talk about hormone imbalance, one of the key things for sure is looking at estradiol or estrogen to progesterone. So you might get your blood work done and see that your levels are within the normal range. So that you might be told that your estrogen's normal, your progesterone's normal, move on. Everything's fine. What I found is that the lab range for estrogen, or really a lot of ranges, but especially hormones, are so broad. You can see a range that is quite all over the place. So it's very, very easy for you to fall within quote unquote normal lab range. The optimal range is going to be different for a healthy, optimally healthy woman. And so, especially with like the timing, you want to make sure you get your hormones tested at the right time of the month. If you're having cycles, you want to go during that mid-luteal phase. So that would be about 7 days after you ovulate, or on like a 28-day cycle. That means getting your blood drawn around days 19 to 21. So you can check this via blood work. You could check it through a urine test called a Dutch hormone test that we do at our office. We also do blood work as well. But we essentially want to look at the hormones and see if, even if the estrogen's kind of normal, the progesterone might be on the low end of normal and the estrogen could be on the high end of normal, and you're still going to have these types of symptoms worsen because there is what we call estrogen dominance. So it doesn't mean that your hormones are wildly out of whack, but if you remember on this previous slide, we've got extra sensitivity in the breast area, the uterus, the ovaries, to slight imbalances. So with the estrogen to progesterone ratio, we typically want to see like a 10-to-1 ratio. So if your estradiol comes back at like 150, for example, you would want your progesterone level to come back around a 15. So that would be what you want to shoot for. Now, if it's up to like a 20-to-1 ratio, I feel like that's kind of pushing it a little bit. But that kind of gives you an idea of whether or not that could be playing a part in some of your symptoms. And then the other part of this is looking at liver detoxification. So even if your estrogen levels and your progesterone levels are perfect, let's say you nailed it with the ratio, if your GI, because the next two is the liver detoxification and gut health, if your gut's inflamed, which you don't necessarily feel, I know a lot of people instantly say, oh, my gut feels fine, but inflammation is a silent thing, so you don't always feel it. But if you've got gut inflammation, if you've got bacterial overgrowth, if you have poor liver detoxification pathways, and this can be from another factor listed here, which might be genetics playing a part, that can tie into your liver detoxification. And then what happens with this stuff is it can influence how your estrogen is used. So again, let's say you nailed it with the progesterone to estrogen to progesterone ratio, but the way your body's processing your estrogen can be helpful or harmful depending on the environment. So if you watched my talk on hormone therapy, I talk a lot about this as well. It goes for HRT just as much as it goes for our natural hormones. So our hormones are affected by the environment of our body. Like how healthy our body is affects how our hormones are used. So if we're more inflamed, if our liver is poor detoxification, then that estrogen can go down a growth pathway that causes more cellular tissue growth. So I see this all the time with our Dutch hormone test or with our GI map stool test, and seeing the data, like seeing the proof that these issues are going on and matching that with the symptoms they're experiencing, like cysts and fibroids and fibroadenomas and different things like that. So I don't think our body does these things just for funsies. Like our body is trying to adapt and respond to all these stressors and imbalances and things that we don't necessarily realize are going on. And it's doing its best. But, that's why I think even though cysts and lumps and bumps and things like that, they're not a serious life or death situation by any means. But this is why I think it's so great to clue into these signs, these warning signs that like something is off. So another factor can be blood sugar and insulin issues. This is huge for ovarian cysts because that's one of the factors that is used in assessing whether or not someone has PCOS or polycystic ovarian syndrome. And ovarian cysts are very, very common with PCOS, and it's really heavily driven by blood sugar and insulin issues. And that can be from diet, stress, lack of exercise. It can be from nutrient deficiencies, making it harder to regulate blood sugar and insulin. So, there can be different ways for us to really dial that in beyond just like trying to not have sweets. It can be a little bit more complicated than that, but that is a huge area that we can work on and fix and improve so that we can really get to the root cause of why you're having these really painful ovarian cysts. Sometimes they're not painful because they're just kind of sitting there, and sadly, there's some young women that have extremely painful bursting cysts with their cycles to where they can pass out from pain. It's really, really bad. And I don't want any woman to be going through that type of thing. And most doctors are just going to immediately prescribe birth control, which I understand in the moment in that situation. You just want to be functional at that point. So there's a time and place for things to be medically managed, but the goal would be to actually address why that young woman is having ovarian cysts develop in the first place. Another factor would be chronic stress. This can be emotional stress for sure if there's been trauma or grief or something really big in their life, but it can also be from chronic stress, which is more of like an ongoing thing, and that can be from lack of sleep or lack of nutrition and nourishment. That can be from just different internal stressors. Like I see this with people who have IBS or SIBO or gut issues or allergies. They have this like constant inflammation response happening, and that's stressing your immune system and it's stressing your nervous system. So sometimes people are like, man, I'm retired now, I have very low stress, I feel great, like in where I'm at in my life, but their cortisol and their stress levels are way too high, and it's more of either an environmental toxin exposure or an internal um, response and like a physical stressor inside that needs to be addressed. So I do see that. Iodine deficiency is another factor with cysts and lumps and bumps. I don't ever recommend taking iodine without checking your thyroid, especially your thyroid antibodies, your TPO antibodies, because some people can really exacerbate and flare up a thyroid problem that they're maybe not aware of by taking iodine. And just as a side note, really popular supplement that I see in the holistic circle is like sea moss, and it's very, very, very high in iodine. So even some of these like natural foods and supplements might be a bit too much, but I always like to look at blood work, maybe an HTMA hair test analysis to look at mineral levels and patterns to see if there's signs of this person needing iodine, especially if their T4 levels are on the low end. And then we can support that and especially support the other nutrients that are important for your body to have on hand with the iodine, because iodine, again, can be stressful for your thyroid if you don't have enough selenium in particular, if you don't have other nutrients, vitamin C, B vitamins, things like that. So we don't ever, like if you ever take iodine and it gives you a racing heart or anxiety or something like that, it's just too much too soon, and some other things need to be dealt with before you can benefit from the iodine. And some people don't need it. So I think some people think that like iodine is the one thing that really helps with breast cysts and fibrocystic tissue. It's really not. It's one of many factors, and sometimes people don't need that at all. They need other things. Toxin exposures, so if there's a lot of plastic bottle use, plastic containers, unfiltered water, pesticides, parabens and stuff in our products, we women, like, we use a lot more personal care products than men typically, and there's a lot of chemicals in those things. So we can use apps like EWG or Think Dirty. It's called Think Dirty, and that's an app that I've used many times to like look up a product or try to find clean options for like my moisturizer and shampoo and all these things. But trying to lower our toxin exposure is super helpful because they act like estrogen, but they don't act like regular estrogen. They're like super estrogens. So they can have a really strong growth effect in our body. And so the less toxin exposure, the better. And then thyroid dysfunction is something that I consider for women with cysts and lumps and fibroids, because if our thyroid is low functioning, then we have slowed clearance of estrogen, and so our body can be doing all the things right, but our thyroid kind of slows things down. It can cause more constipation, which can also contribute to estrogen buildup as well. So definitely want to look at the thyroid, make sure that that's balanced and happy. And then inflammation. Inflammation changes the cell function and proliferation, meaning like growth. And so it can alter those functions on a tissue level and increase the likelihood of these types of growths in the body. So whenever we have chronic inflammation, we need to be looking into addressing that as part of the big picture for sure. And genetics, like I mentioned earlier, talking about the gut and the liver, genetics do play a part for sure. It doesn't mean that you have to have these problems left and right. It might always be a little bit of a struggle or something that you have to be intentional about supporting, but knowing that certain nutrients and certain things, supplements and diet and lifestyle, different things can really help optimize the genetics that you were given. You know, we all kind of have like this deck of cards to work with, but thankfully there are ways to make our genetics not have to work so hard to keep up with things. So that can be certain nutrients, B vitamins, magnesium, you know, things like that. And when we're under chronic stress, or when we're inflamed, or when we have blood sugar issues, or all these different things, what happens is we have to, there's an increased demand on our body. When we have more inflammation or stress, our body has to utilize more building blocks of repair. So magnesium, B vitamins, protein, you know, all these different things to keep up with the stress, keep up with the inflammation, and try to like keep your head above water. So imagine like if you're already under stress and you're already burning through your magnesium or B vitamins, different things like that, and you have a genetic SNP that makes you more susceptible to estrogen issues, like having those certain deficiencies in nutrients is going to make those issues more present, more prevalent. So we want to work on all of these things together. So a lot of people are like, well, how do I know what factors are affecting me? And sometimes it can be nice to do like a thermography scan and get a visual of different areas of inflammation in the body, but it doesn't always tell us specific details. So what we like to do at our office is get some hormone testing done. And you know, one of the coolest ways I would say to get an idea of a lot of these causes listed here in one test, not that it fully assesses all of it, but I feel like I get a lot of information from a Dutch hormone test, because we look at the hormone levels for hormone imbalance. We can see how your estrogen is being processed through the urine. So we can see if that gives us clues about liver detoxification. And we can also see, not that there's a lot of information from the Dutch on gut health, but there are a couple markers on the Dutch that give me clues to whether or not this person is dealing with gut inflammation or bacterial overgrowth. And there are certain patterns on the Dutch that can indicate more likelihood of having blood sugar and insulin issues. And it also looks at the whole adrenal panel, which would give me a really good idea of what stress levels are looking like on a day-to-day basis. So that one test, I will say, touches a lot of these factors. Now, the blood work would be more specific for blood sugar. We can look at insulin, A1C, fasting glucose. We can really get more specific data so that we can track it and make sure we're nailing that issue. And then we can look at certain blood tests for liver function. I think that can be a lot more detailed in blood work, but there's some really good information on the Dutch too. So kind of get both of those tests are great. And of course, the blood work, we can also look a little bit of clues with blood work for gut health, but ideally a comprehensive stool test would be the way to go for assessing your gut health in detail and getting a real strategic approach to dialing that in. And then when we look for iodine deficiency, this is where I look at like T4, I look at calcium levels in the blood, I look at other clues in the blood work, or like a hair tissue mineral analysis test that we can do at our office, and just kind of look for patterns for iodine deficiency, and of course support the other things as well, like selenium, definitely. for toxin exposures, now I always typically, not always, but I typically start with blood work, GI map stool test, maybe a Dutch as well. If we can do all three of those, that's awesome. Now, if for some reason someone is really worried about toxin exposure, or if they suspect that they have mold exposure or heavy metals, the total tox urine test is going to look at all of those things in one test. So that one's really awesome for looking for other sources of inflammation and hormone imbalances, because your hormones might be perfect, but you might have hormone issues still and hormone symptoms because these chemicals are acting like estrogen in your body. So that's a really cool way to have a very different perspective that can be very helpful. Thyroid, of course, I look at blood work. That would be the best way to assess. But I'm not just talking about a thyroid panel, because it is so important for us to not just replace thyroid hormones or take more iodine and selenium. Like, yes, we want to address those things, but if we don't address why the thyroid has slowed down, because to me the thyroid, it is adapting to chronic stress. It is slowing down in an effort to preserve energy. Your thyroid is tied to your metabolism and your energy production. And if you are running on an empty tank and you are running on fumes, your thyroid is wisely slowing down so that it can preserve your nutrients and your energy capacity. Like it's not, giving up on you or like broken or something like that. So I view low thyroid function as kind of like high cholesterol or cysts and fibroids. Like I see it as a symptom, a sign that there are chronic stressors going on that we want to address and nourish the body and remove the stressors so that your thyroid can naturally function as it wants to. But typically it's a stress response when the thyroid is slowing down or nutrient deficiencies. So when I say checking the thyroid, I mean a full blood work panel, because we want to see if there's hormone issues, histamine issues, inflammation, gut, liver, blood sugar. All these things affect our thyroid function. So full blood work panel, definitely checking for anemia or low iron. If you have low iron chronically, that definitely affects the thyroid as well. And we're not going to have a very easy time fixing the thyroid until we fix anemia. It can kind of become this domino effect and interconnected. So I definitely like to look at a full blood work panel, so that we're not just fixing things as separate pieces. It just does not work very well. For inflammation, trying to see like if this is part of your cyst, fibroid, situation. Thermography is great for looking at inflammation. Sometimes we might see blood work showing signs, so that can be like your CRP levels. I see CRP hit or miss. Like sometimes it's ridiculous. It looks normal, and I know for a fact that person's really got a lot of inflammation. So that one's kind of hit or miss. Homocysteine, you can see this creeping up a little bit over an 8 or 9 or 10. We're starting to see some vascular inflammation. We might see increased cholesterol in response to inflammation in the body. We might see some low globulin if there's GI inflammation. And we might see elevated ferritin, which is storage form of iron, because there's tissue damage, because the ferritin should be inside the tissue, not circulating in your blood. So when we have high ferritin, we might have some tissue inflammation. And then for genetics, looking at your actual genetic testing would be the most, accurate and thorough. The Dutch hormone test does have one tiny little section on there, a marker that is a partial way of giving us a clue into methylation and COMT activity, COMT, which is a genetic SNP. And a lot of people with estrogen issues, detox issues, have genetic COMT or COMT SNPs or MTHFR SNPs. We see it all the time, super common. Again, that's not a thing that is set in stone. It's just good to know those little weak links that need extra support. So ultimately, lumps and bumps, as long as they're benign, they're not a serious issue typically. They don't have to be something to be really fearful about. That's not the point of this talk. I really just want women to take it as an opportunity to listen to their body and dig in a little bit deeper as to why that popped up, and if there's something that your body would benefit from getting balanced out. And so many times, if we're balancing those things out in order to address cysts and lumps and bumps, we have so many other benefits that come about from that process of balancing things out, where we have better mood, we have better sleep, we have better stress responses, we have better GI and thyroid function. All these different things are going to benefit from focusing on the root cause issues. These different issues that I'm talking about here are going to benefit so many areas of your health. So that's kind of the cool thing about working on things holistically, is that I always say there's positive side effects. We're always hearing about bad side effects, negative side effects from prescriptions, but like, if we prescribe ourselves some healthy things, there's so many positive side effects from it. So I hope that's encouraging. I hope it gives you some ideas, and this is just a couple examples of like how we can work through inflammation, root causes, start to see some improvements, and take action. It doesn't again, this stuff does not have to be set in stone. We can make healthy changes and we can reap the benefits. So hope that's encouraging, and reach out if you are interested in testing or want to talk about anything that you're dealing with right now. We love to help. So thank you so much for your time, and reach out if you